improving services for patients is at the very heart of the Prudent Healthcare agenda. Now we know, difficult as it is sometimes to explain this to people, that a lot of what goes on in the healthcare world either does people harm or does them no good. Healthcare-acquired infections, the clue is in the title, isn't it? These are infections acquired as a result of receiving healthcare. So healthcare can do harm as well as doing good, and we need to bear down even further on eliminating that harm. And we know as well that the nature of knowledge changes all the time, that evidence is always emerging, and some of the things that we believed were effective in the past, we now know have been overtaken by other ways of doing things that are more effective. And therefore we have to do more to drive out of the system those inherited ways of acting that no longer provide the best outcome for patients. And there's a great deal of help for us in all of this. NICE provide all sorts of advice and evidence on things not to do. We have the interventions not normally utilised list in Wales, which we are reviving and trying to give a bit more impetus to. And there's work going on across the world now. Canada, for example, the Choosing Wisely Canada initiative, which gives clinicians very precise, very direct, very practical advice about things not to do because these things are known not to have a clinical effectiveness. Prudent healthcare means for staff that you should only do what only you can do. In other words, nobody should be routinely dealing with people at a level below their own clinical competence. Nobody should be seeing a consultant when that person's needs can be perfectly clinically properly attended to, let us say, by an advanced practice nurse. And I think that will mean some very profound changes in the way we think about our workforce, our deployment of the workforce in the future. I am very keen that everybody who works in the Welsh NHS works right at the top of their clinical licence. And this will mean a new discussion with patients, but I think patients will quickly come to see that they are seeing the right person who is able to provide the service they need, and that they will do that with a wider range of health professionals in the future. The nature of the conversation with patients will change. It's to be a much more co-productive discussion in which we capture the contribution that patients themselves can and need to make to their own well-being in the future. And for staff, it will mean sometimes being willing to remodel the service that you provide so that you intervene at the level that intervention is necessary, that we avoid the danger which is inherent in the health service of accelerating people up professional hierarchies, that we fall into the trap of believing that doing more must always be to do better, and that volume is somehow the touchstone of quality in the NHS when we absolutely know that it is not. I am absolutely sure that if you want to get a prudent healthcare system to work, then asking people who provide the service themselves how it can be realigned on a prudent healthcare basis, that's where you will get the best advice. And we have to make sure that people have the confidence that their voices will be powerfully heard in that, and that they won't run up against all sorts of organisational barriers to making the changes that they need to make. I know that in Welsh Government we need to realign some of the way in which we set targets for organisations. I had a very interesting conversation recently with a senior figure in a social services department here in Wales. He said to me, if we draw somebody into a service, if we draw an older person into a social service, that person is recorded as having a service and we get money as a result of it. If we manage to keep that person out of the service through reablement action, get them on their own 2 feet so they don't need to have a service for the future, they don't appear on our list and we don't get money for it. Now, I understand there's work we have to do to make sure that we align the rewards, the way money flows in the system, with the outcomes that we want to see. And in that example, all our efforts should always be directed towards maximising an individual's own ability to take care of themselves and their own health and their own social well-being, because that's what we know people would prefer. One of the things that I think is genuinely exciting for us in the Prudent Healthcare agenda here in Wales is that I think if we get ourselves geared up to this way of thinking, we will find ourselves at the leading edge of a wave of activity that is happening not simply in Wales but right across the world. We really have an opportunity here to be at the leading edge of something that is going to be important globally, not just locally. So we need to be able to draw on the help that we will get from work that is going on elsewhere, from work that is going on through national organisations such as NICE, but the 1,000 Lives campaign is our own made in Wales way of doing things. It will be a really important engine of change in all of this, gathering together the evidence, making sure that we are working directly with our clinicians, with staff who provide the services, with the patients and families who experience those services, and using that experience to try and make sure that these very basic principles of prudent healthcare actually make a practical difference to the way that services are going to be planned and provided in Wales in the future.